Psychiatry for 10th semester. Psychiatry. A definition and scope of psychiatry. Definition. Psychiatry is a medical specialty focusing on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. It bridges the gap between biology, psychology, and sociology to understand human behavior comprehensively. Scope. Psychiatry involves managing a wide range of conditions, from mild anxiety disorders to severe psychotic and neurodevelopmental disorders. It also addresses the psychiatric dimensions of medical and neurological illnesses. B. Classification of psychiatric disorders. 1. Mood disorders. Major depressive disorder, MDD, persistent low mood. Loss of interest, and somatic symptoms like changes in sleep or appetite. Neurobiological mechanisms involve reduced serotonin, norepinephrine, and dopamine levels. Bipolar disorders. Alternating episodes of mania, hypomania, and depression. Strong genetic predisposition, with abnormalities in circadian rhythms. 2. Anxiety disorders. Generalized anxiety disorder, GAD, chronic. Excessive worry about everyday situations. Linked to hyperactivity of the amygdala and low GABA levels. Obsessive-compulsive disorder, OCD. Intrusive thoughts, obsessions, and repetitive behaviors, compulsions, aimed at reducing anxiety. Dysfunction in corticostriatal thalamic cortical circuits. 3. Psychotic disorders. Schizophrenia. Positive symptoms, hallucinations and delusions. Negative symptoms, flat affect, social withdrawal. Cognitive deficits, impaired working memory and executive function. 4. Neurodevelopmental disorders. Autism spectrum disorder, ASD, impaired social communication and restrictive, repetitive behaviors. Associated with mutations in genes like SHANK3. ADHD. Inattention and/or hyperactivity impulsivity. Neurotransmitter dysregulation, dopamine and norepinephrine. 5. Trauma and stressor-related disorders. Post-traumatic stress disorder, PTSD. Exposure to trauma leads to re-experiencing, avoidance, negative mood, and hyperarousal. Dysregulated hypothalamic pituitary adrenal, HPA, axis contributes to the condition. 6. Substance-related and addictive disorders includes misuse of alcohol, opioids, stimulants, and gambling addiction. Neurobiology involves reward circuitry dysfunction, particularly in the mesolimbic dopamine pathway. C. Etiology of psychiatric disorders. 1. Biological factors. Genetics. Heritability plays a significant role, e.g., schizophrenia approximately 80% heritability. Neurochemical dysregulation, dopamine hyperactivity in schizophrenia. Serotonin deficits in depression. brain structure and function, reduced hippocampal volume in PTSD, enlarged ventricles in schizophrenia. 2. Psychological factors: childhood adversity and attachment issues, maladaptive cognitive schemas and behavioral patterns. 3. Social and environmental factors: socioeconomic adversity, discrimination, and trauma exposure. Chronic stress and lack of social support. D. Diagnosis in Psychiatry 1. Clinical interview: detailed history taking, including psychiatric, medical, family, and social history. Assessment of symptom duration, severity, and impact on functioning. 2. Mental status examination, MSE, evaluates appearance and behavior, speech and thought processes, mood and affect, cognitive functions, including memory and orientation. 3. Psychological tests: Beck Depression Inventory, BDI, for depression severity. Hamilton Anxiety Rating Scale, HAM-A, for anxiety disorders. 4. Neurobiological and imaging techniques: functional MRI, fMRI, identifies abnormalities in brain activity. Electroencephalography, EEG, for seizure-related psychiatric disorders. E. Management in Psychiatry 1. Pharmacological interventions: antidepressants, SSRIs, e.g., sertraline, first line for depression and anxiety. SNRIs, e.g., duloxetine, for depression with somatic symptoms. Antipsychotics, atypical agents, e.g., risperidone, effective for positive symptoms of schizophrenia. Depot injections for non-adherent patients. Mood stabilizers, lithium, gold standard for bipolar disorder. Anticonvulsants, e.g., valproate, for manic episodes. Anxiolytics, benzodiazepines for acute anxiety, short-term. Buspirone for chronic anxiety management. 2. Psychotherapeutic approaches: cognitive behavioral therapy, CBT, effective for depression, anxiety, and OCD. Dialectical behavior therapy, DBT, tailored for borderline personality disorder. Trauma-focused therapy, exposure therapy or eye movement desensitization and reprocessing, EMDR, for PTSD. Family therapy, for systemic issues, especially in adolescence. 3. Other modalities: electroconvulsive therapy, ECT, used for severe depression and catatonia. Transcranial magnetic stimulation, TMS, for treatment-resistant depression. Ketamine therapy, emerging use in treatment-resistant depression. F. Prevention and rehabilitation 1. Preventive measures: primary prevention, early intervention for at-risk populations. Education campaigns to reduce stigma. Secondary prevention, screening for early signs of mental illness. crisis intervention to prevent escalation. 2. Rehabilitation programs, vocational rehabilitation for patients with chronic mental illnesses. Psychosocial support for reintegration into society. 3. Role of technology. Telepsychiatry increases accessibility to psychiatric care. Digital apps for monitoring mood, medication adherence, and mindfulness training. Wearables tracks sleep, stress, and physiological indicators. G. Emerging trends in psychiatry. 1. Precision psychiatry, personalized treatment plans based on genetic, neuroimaging, and environmental data. 2. Artificial intelligence in psychiatry. AI-based tools for screening, diagnosis, and treatment recommendations. 3. Psychedelic-assisted therapy, controlled use of substances like psilocybin for depression and PTSD. 4. Neuromodulation techniques, deep brain stimulation, DBS, for treatment-resistant OCD and depression. 5. Integration with neurology, recognizing neuropsychiatric syndromes like Parkinson's-related depression or post-stroke anxiety. H. Ethical and legal considerations in psychiatry. 1. Ethical challenges ensuring patient autonomy and informed consent. Balancing patient safety with confidentiality. 2. Legal aspects. Mental health laws regarding involuntary admission and treatment. Rights of patients with psychiatric illnesses. This expanded and integrated explanation provides a comprehensive overview of psychiatry, highlighting its foundational concepts, clinical practice, and future directions. It combines biological, psychological, and social perspectives to address the complexity of mental health care.